Thank you. Thank you. So welcome to everyone, welcome to people in the room and to those joining us online and at the side event where we would like to spotlight the critical role of the law enforcement in the public health approach to the drug policy, with the main, although not exclusive, focus on the region of Central and Eastern Europe and Central Asia. Well, there's a global recognition of drug use as a health and public health issue, and decriminalization becomes an obvious goal and an approach introduced in many countries already, also suggested for implementation in numerous UN documents, including the UN Common Position on Drug Policy or the report issued by the Office of the High Commissioner for Human Rights. In many countries, especially many countries of our region, my home country, Poland, included, a punitive approach remains in place, and drug possession, even for personal use, is still criminalized. So while awaiting the critical changes at the legal level, it is important to find solutions between different stakeholders that could mitigate the harms created by the punitive law and could have a positive result for people who are targeted by the law, for people whose role it is to enforce the law, and for the society as the whole, who pays the cost, economical and public health costs for the existence of these laws. So let me say that in December last year, Helsinki Foundation for Human Rights, the organization that I have a pleasure to represent today, was pleased to co-host with numerous organizations and institutions represented at this table today as well, the event preceding the European Harm Reduction Conference, which event gathered law enforcement representatives, prosecutors, judges, drug policy experts, and advocates, as well as civil society engaged in providing innovative responses to the drug situation, responses that are rooted in the public health-oriented approach. And with today's side event, we want to share in a snapshot what was presented and discussed in Warsaw. And I'm very grateful to the distinguished speakers who joined us, the majority of them in Warsaw and also today. And these are, let me briefly introduce, and then I promise to be already. Gorica Popovic-Mostrac from UNODC. Gorica is the global focal point for the law enforcement in AAG 8 section of the UNODC. Bojan Konstantinov, policy specialist for human rights and health technologies in the UNDP. Bojan kindly agreed to meet with us today, but as we all know, there are a lot of overlapping events here at the CND, so he will have to leave shortly after his presentation. Neil Woods, the board member of the Law Enforcement Action Partnership, LEAP UK and LEAP USA. Kirsti Hindrus, prevention work coordinator in Estonian Police and Border Guard Board. We hope to have a representative of the Ukrainian police with us, but unfortunately it was not possible, also due to that current situation in Ukraine. But last but not least, Gana Dovbak, Executive Director of the Eurasian Harm Reduction Association. My name is Magdalena Tomkowska. As I said, I work in Helsinki Foundation for Human Rights in Poland. But that's all from me right now. I'll give the floor first to Gorica to speak about UNODC's work with the law enforcement when it comes to that drug policy.
Thank you, Magda. Thank you, everyone. Hi from my side as well. I am very happy to be part of this small but very vocal group when it comes to the working with law enforcement and supporting the public health oriented policing, not only in the region of Eastern Europe and Central Asia, but obviously beyond. I want to thank obviously the organizers for having us at this event and for keeping the momentum from Warsaw going. From my side, what I obviously will repeat, and you've heard this before, not only in Warsaw, but in general, is that obviously working with law enforcement in HIV response and when it comes to policing key populations is absolutely essential and cannot be overstated. Law enforcement serve as the first point of contact for these populations, for people who use drugs, for people in police detention and prison settings, for sex workers, for all other key populations. And the way law enforcement engages with these communities determines whether these individuals can access life-saving services or are driven further into the vulnerability. And punitive approaches such as aggressive policing, incarceration, over-incarceration, and in some contexts also harassment of key populations have obviously failed to reduce the drug use or to improve public safety. So instead, what this has resulted in is often that they have fueled stigma, deterred people from seeking healthcare, and obviously exacerbated already existing public health crisis. As I said, not only in this region, but well beyond. So that being said, the evidence is fairly clear. You've heard throughout the whole of this conference, we're already 3 days into CND, you've heard a lot of data, a lot of epidemiology across the world. Drug-related health challenges are very much a problem still. And people who fear arrest, people who fear contact and interaction with law enforcement services in this region and beyond have continuously been prevented from accessing the services that are available to them, whether that is in the community or in prison settings. Another thing that's very important to note is that overrepresentation of key populations, such as people who use drugs, sex workers and others in prison and criminal justice system has not only exacerbated their health outcomes in the community, but also have worsened the crisis of healthcare in prisons. And I think that we all kind of see that these circumstances call for a shift in the way we understand and the way we work with law enforcement. They are and they should be an essential partner and not a barrier to services. They have a crucial role in creating an enabling environment where people who use drugs and other key populations can access services that they need without fear of arrest or marginalization. And instead of focusing on or employing punitive approaches and police practices, we should focus on public health-based policing. And that includes, among others, referrals to health and social services that are available in the community rather than arrests. It should focus on collaborative initiatives with different stakeholders, civil society, public health institutions. It should focus on crisis intervention rather than punishment. And obviously, it should support and establish diversion programs rather than incarceration. I really want to strongly emphasize that public health policing does save lives and it also contributes significantly to community trust. We have seen that countries that train their police forces on public health center approaches, on human rights, on gender responsive services, have seen improvements in community relations, in crime prevention. They have also seen reduced HIV and viral hepatitis transmission rates. They have also seen a lot fewer fatal overdoses. Obviously, that might not to a great extent be applicable to the Eastern Europe and Central Asian region, but it's nevertheless a lesson that we need to take into account. So in multiple countries where law enforcement and civil society organizations have successfully worked together, we've seen benefits. On the UNODC side, this work has been going on way before my time. So we have started this work back in 2013. And I do have to say I'm exceptionally proud that I've started working in this area, specifically in the region. And I think that one of the great examples of our work on law enforcement is exactly the collaboration that we have with civil society and the fact that they have always been great partners, not only to UNODC, but also to law enforcement agencies in countries of Eastern Europe and Central Asia. And on a global scale, but also in this region, the focus of our work, or the bulk of our work, focuses on obviously building the capacity of law enforcement agencies. For them to be engaged and informed partner in HIV response or in public health response, more generally speaking, they need to be capacitated. And this is the primary focus for UNODC. On the other thing that we strongly support and promote is obviously alternatives to incarceration and punishment. So we are supporting national authorities to expand or establish existing police referral mechanisms or diversion programs, therefore diverting people from criminal justice system to treatment or other services such as HIV prevention and treatment programs that they need. And finally, I would say the highlight of UNODC's work with law enforcement is in partnership building. We are trying not only to build partnership with different law enforcement agencies, with law enforcement officers of different ranks, but we are very much committed to build partnerships between different stakeholders. Law enforcement agencies, civil society, local administrations, public health authorities, and so on is from my personal but also organizational perspective is the way to go. And I will try to wrap this up being mindful of the time. I think that we're all aware that taking into consideration the persisting challenges when it comes to drug-related health issues, especially HIV, among people who use drugs, people in prisons and other key populations, is that we need to align law enforcement practices with public health goals to be able to effectively manage these public health crises. And current police strategies in many contexts, including in Eastern Europe, Central Asian region, often fail to address public health concerns, and in some instances, they actually contribute to increased vulnerabilities and issues among these populations. And I think that we should fundamentally rethink the role of law enforcement in public health in addressing drug-related issues. We have seen from both theory and practice that punishment in of itself is not solving anything. But on the other hand, public health oriented policing and strong community partnerships, and obviously policing practices and law enforcement decision making that's based on evidence should become the standard. So what I will say is that the decisions that we make today, whether to maintain outdated approaches or to fully embrace public health policing, will shape the future of HIV response and human rights protections in the region. And UNODC remains fully committed to support these efforts, to support partners from the civil society. And I think that what we've done in Warsaw and what we've seen in Warsaw is that there is a lot of appetite from different stakeholders, not just from the civil society and public health sectors, but especially from law enforcement, from judges and prosecutors. There is a lot of appetite to sit down and work together and not just be the topic of discussion, but to actually be a fundamental part of it. And I think that this is something that we should continue, and we should streamline our efforts to make sure that this is the momentum that we keep going. So yeah, I will not take any more time. This is, I think this is all I wanted to say. So thank you very much, and looking forward to the chat. Thank you.
Thank you very much for making all these important points. I would say that they're even doubly important when shared by UNODC. So thank you for that. And we'll stay with the UN level and UN agencies. So over to UN right now, UNDP works a lot as well with judges and prosecutors. So we also came to hear about that perspective.
Well, thank you very much. And indeed, it's a good follow-up to what my UNODC colleague Gorica was talking about. Maybe a quick word: why UNDP works with judges, and why is UNDP engaged in this process? As you know, UNAIDS is a joint program, and UNODC as well as UNDP are co-sponsors. And under the Division of Labor, UNDP supports the work on law and policy reform, and together with UNODC and colleagues from UNFPA, the Population Fund, we support the work with and on key populations for them to be able to access services, but also access to justice and to have their human rights protected, respected, and fulfilled. So UNDP has been historically supporting countries in their efforts to reform the laws in order to have better HIV and health outcomes, which is also good for development. And as such, we were the host and the secretariat of the Global Commission on HIV and the Law. And this commission made recommendations that to this very day, it was an independent commission, that to this very day we are following up with. And the work with the judges was one of these recommendations, as is the work with prosecutors, as is the development of policy advocacy documents that support these processes. So to give an example of a policy document that is very relevant to our current discussion that has supported such processes, these are the international guidelines for human rights and drug policy. So they reconcile, broadly speaking, human rights standards with the three drug conventions and advise all stakeholders, including the judiciary, of how these can be applied so that countries remain compliant with the drug conventions and yet minimize punitive approaches, which we know don't work, which cost a lot of money, and which impact very badly livelihoods, health outcomes, and many other aspects. So the guidelines were first used by twice by high courts in Colombia to actually decide against punitive approaches and pushing towards public health responses vis-a-vis drug contexts. And then were used also, again, in Eastern Europe to train judges in Albania with support from GIZ, OHCHR, UNAIDS, UNODC was also very, very helpful. And this network still exists, and it was actually the network of women judges that spearheaded the follow-up process because they realized how much more women are impacted by punitive drug approaches. So this is just an illustration of how a policy advocacy document, which by the way is a partnership, so UNDP partnered with many stakeholders, University of Essex, with OHCHR, UNAIDS, WHO, UNODC was very helpful with the regional guidelines, and of course with civil society all around the world. To lift it off the ground. It comes to show how it can actually be transmitted to the judiciary level and impact judicial decisions for better outcomes. This said, there is also the need to engage with the judiciary. HIV is actually a good platform to do this because we now have scientific consensus when it comes to HIV transmission, exposure, and non-disclosure. And when judges don't like to be sensitized, but when you have consultations with judges, they understand better why punitive approaches don't work. This is also relevant to punitive approaches to drugs and people who use drugs, and what are the opportunities to do better. And judges learn from judges. They talk to judges, to their peers, and when they see a good decision and a good legal argument, even if it is from a different jurisdiction, they know how to transpose it to their jurisdiction. And we have had such successes when it comes to the work with judges in Africa. This is a judges forum that has like a long history by now, I think more than 11 years. And a lot of decisions. So there were the first decisions in Kenya that were regarding exposure to HIV, mother-to-child transmission, but now we have also judicial decisions that have influenced decriminalization of same-sex relations. So Botswana, Mauritius, and Namibia are such examples. Recognition of LGBTIQ organizations that couldn't register, but after the judicial decision that became possible, for instance, in Botswana, in Kenya, and Eswatini. I mentioned the expanded protection of women's rights, particularly when it comes to sexual and reproductive rights, including mother-to-child transmission. And then recently, this is relevant to the region of Eastern Europe and Central Asia, a decision in Tajikistan about U equals U, which is a very important decision in this region where we still have laws that predominantly criminalize HIV transmission. So it shows a shift, which we hope that will continue to amplify and multiply in order to deal with these negative legal situation. And I come from Bulgaria originally. I have worked a lot in Eastern Europe and in Central Asia, and it's very, very hard to change laws. in countries that are based on the Anglo-Saxon system, this is easier through judicial decisions. It's very hard in the Land Act system. It's very hard to change laws. But decisions like this, they can influence practices of courts and still mitigate the great negative impact that such inadequate for our times decisions like criminalization of HIV transmission can have on people. The last thing that I want to say is that there is an opportunity to engage at an even earlier level, and this is working with prosecutors. And that's why we developed these guidelines for prosecutors when it comes to HIV, because they do have an opportunity. They have an opportunity to prosecute and an opportunity not to prosecute. So there is a lot of decision-making power at this very start of the process before it actually goes to courts. Prosecutors are not stupid people. And they also realize that this is a waste of resources. It's not really based on sound science, and it's something that they're required to do in order for them to be assessed as successful, and because the law tells them to do. And so if you indicate what is the leeway, the opportunities within the law not to go ahead with the court case and not to get a sentence at the end, and they could use this, that's a welcome option for them. I think we still need to invest more in working with the prosecutors. It's a costly process, but we're open for partnerships there with UNODC, with any other organizations and agencies that work with prosecutors. We have the documents, we have the policy documents, so we just need to implement them more. The last thing that I want to say before I end is, with all this, we always have to keep in mind that we have to work with legislators as well, because we can get many good outcomes with prosecutors, we can get many positive judicial decisions, but the important thing is that we also change bad laws and policies in order to have durable solutions or inadequate provisions that, as we all know, you better than me, impact people's lives and people's health. Thank you.
Thank you very much, and thank you for making yourself available today, despite that overlapping commitment. I believe it is also important to say that we've heard about the law enforcement, the police work, the prosecutors, judges, but I believe it is, we will all agree, we could see that in Warsaw, that an important part is also that all these groups do not work in silos only, but they meet, exchange, and work together. So thank you very much for that. Bojan mentioned peer-to-peer education, and like judges prefer to hear from judges. So thinking about the law enforcement audience, we do have law enforcement people here with us, willing to share some examples of how actually this public health-oriented policing could look like, or it looks like in different places. So over to Neil Woods right now, who will share a few of these examples.
Okay, thank you. And thank you again for inviting me to be part of this this collective. I always feel honoured to be able to contribute to this particular group. I will cover some examples, as you just said, but I think just before I do that, I think it's worth pointing out that there is lots of evidence when you talk about social justice advocacy that you have to address the fears of your target group or target audience at the same time as presenting them with the evidence. And this is particularly important, I think, with police, because I used to work undercover. I used to catch drug dealers for a living, and human rights was not at the top of my list of concerns. Very, very far from it. In fact, there have been times when I saw them as being a barrier to what I needed to achieve in terms of public safety and security. So when you talk to police, and I think you are doing a great job by having these meetings, that the Warsaw meeting was a great example of it, bringing the right people to the right place. But as we move forward, we need to keep in mind that you have to address the concerns of police. So there are some advantages in doing that. There is a growing movement of public health approaches to policing in the world, and that has been growing particularly since 2012. When that movement started, drug policy wasn't really part of the discussion. It's been brought in through the side door, so to speak, that, hey, look, this is also public health. And another side of it, another advantage that's happening within policing is the move towards evidence-based policing. That there is a genuine aspect of police leadership who believe that we should be following evidence in the decisions we make within policing. This is also an opportunity. So in that vein, and as Magnus just requested me to do, I'll make some references to where there are examples of police-led or police-involved public health solutions within drug policy. And I think my favourite one is one from the United Kingdom. Back in about 2015, the Chief Constable of Durham Constabulary in the UK, Mike Barton, with his sort of political oversight, the Police and Crime Commissioner, Ron Hogg, they were very much of my mind. They were members of LEAP. But they wanted to prove that drug law reform was not only better for the issues that have been discussed already, for people who use drugs, for health, for public health, but also better for public safety and better for policing. And so they created the first true diversion scheme in the UK, which is a de facto decriminalisation. And what they did is they gathered evidence by having a cohort. They divided people into halves. It was the luck of the draw whether you got diverted or whether you got sent into the criminal justice system as per the tradition. I always feel particularly desperately sorry for those unlucky people who have the potential opportunity to get diverted away from the courts, and they didn't just because they flipped a coin. But still, you know, it's in the nature of policing to gather evidence, and it was the right approach. Because the evidence from that was quite clear that those people who got diverted away from the courts into treatment and into harm reduction, because you can be diverted into harm reduction as much as you can treatment, and often that is the better option. The diversion, the people who were diverted, there was an 80% difference in the recidivism. The people who came back to commit further crimes. 80% is a big number. And they were able to prove that from the very carefully way they crafted the evidence. Now, what that did in the UK is it sparked a series of other diversion schemes in different constabularies. Now, unfortunately, where a constabulary, and I think there's 47, is the 47 Nickel now?
43 in England.
43, there you go, 43 in England and Wales. Within those constabularies, it really was a postcode lottery whether you were going to get a diversion scheme, and that was about the political oversight and the political philosophy in that particular place. But it happened, and we've had lots of diversion schemes in the UK. Some of them have been pre-arrest as well, so that people don't even have an arrest, the trauma of an arrest. They're found with drugs in the street and they are diverted at that point before arrest to a drug treatment service provider who will provide them with the appropriate harm reduction and associated advice, or, in some people's cases, treatment, depending on what treatment may or may not be required. And this has been remarkably successful. The evidence has been mounting and mounting, but we've had this peculiar situation in the UK where the police have been leading essentially on decriminalisation in spite of politics, not because of politics. So I love that example because there is so much terrible about drug policy in the UK that I've been able to travel here and there and be really proud of what the UK has done. This has been led by police, it's been led by the evidence, and it's not just been good for people who use drugs and young people who we really need to keep away from the criminal justice system. It's also been good for reducing crime. And this brings me back to my first point that police leaders here, there, and in many places will be resistant to reforms which take away their options, sometimes take away their options of power, take away their options of an arrest because they see an arrest as a way of reducing crime. Because if you have someone in custody for a small amount of drugs, you can use that to manipulate them into providing information. And you can. I'm a manipulative sort. I have been that cop who has persuaded people to give information in order to reduce a sentence. And that is the most significant mechanism within prohibition from policing. But that drives violence. It drives violence. The use of police involvement drives violence because that incentivizes drug dealers to become the most scary, the most intimidating, the most ruthless. So they're not the people who are grassed up. But police institutions themselves don't actually understand that. So we have to be able to engage on how the police understand this and how they view this. Another aspect of it is if you send someone to prison, say they've been caught using drugs 3 times, they go to prison. Drugs within prison are between 2 and 4 times more expensive anywhere in the world. They're always at least twice as expensive, usually 4 times more expensive. Organised crime has become much more sophisticated in how the line of credit is developed so that people can buy those drugs in prison. It's all done on credit, which means that when they come out of prison, they have an enormous debt, accruing interest, and that is a significant driver of crime, significant driver. But most police institutions do not organisationally understand this because they're not paying attention to their own criminal intelligence systems, which can tell them this. So in order to persuade police to support these evidence-based moves to use public health approaches to criminal problems, you not only have to use the evidence of beneficial health outcomes, you also have to understand what those barriers are and how this can reduce crime. And I've got a minute and a half left, so I'll just add one point. This is not just good for public safety and reducing crime, this is also good for police. It's good for police officers. And there is a mental health crisis in policing all across the world. There's record suicides of police in Malaysia, in the United States. It's an epidemic that police leaders are very concerned about everywhere. In the biggest study into PTSD, into police mental health that's ever been done, involving 18,000 subjects, 18,000 is a huge study. This was in the UK in 2018. Unfortunately, there wasn't much use of this study because COVID hit just as it was published. So it hasn't really been capitalized on as a piece of evidence. But one of the key takeaways from this is that a mitigating factor for a police officer's descent into ill mental health is whether they feel that their work is meaningful. And an aggravating factor is if they find that their work is meaningless. We have hit the point in policing, to today's topic, where the police job can be either meaningful or meaningless. And that involves decriminalizing drugs, looking after people rather than persecuting them, taking people away from the criminal justice system rather than sending them repeatedly into it. So this is also good for police mental health, which also has its political issues, because police retention, recruiting, sickness is a political concern, so which also allows us to have an avenue into politics. So thank you for listening.
Thank you very much. I'm impressed as always when I listen to you, Neil, and also thinking about how precise you were in timing. So thank you. Thank you very much for that. And we will right now move to Estonia and hear about another example, the powerful one, from Estonian colleague. We do have a presentation with you.
Yeah, thank you. My name is Kirsti, and I'm a prevention work coordinator in Estonian Police and Border Guard Board. Nice to be here. Thank you for having me. So I'm going to talk about implementation by program suiting implementation by the law enforcement. So about the program is originally from USA, and we started to implement it in 2018. Right now, the program is implemented in 5 of the regions. And not only the police uses the program, but also prosecutors' offices, probation officers, and prison system, and of course, health and social services as well. So about the statistics. Last year, there were 85 drug overdose deaths. Since year 2000, 2,197 people have died to a drug overdose in Estonia. There are only 1.3 million of Estonians. So I can say that we as a nation are probably not yet ready to decriminalization, but we are pro saving lives 100%. And as seen on the statistics map, there are more clients in CITIC program over the years and referred by the justice and law enforcement system as well. But the number would be even bigger if we had more funding. So, next slide, please. Thank you. What is the program and what do we do? There are some differences in different regions, but basically, if patrol officer, first responder, gets in contact with the person who uses drugs on scene, then he still collects information regarding drug use. He does background check and then offers the program to the person. If the person agrees, then we will make a note to our database and no legal punishment will follow. What does the person who used drugs do? She accepts to participate. Then he has to make a call to the support person on scene. The police officer has to actually hear that the call is being made. And then he will have to give consent to participate in the program. What does the support person do? He gets a call from the person on scene, makes an appointment. If possible, then at the scene, the police officer will wait for the support person to meet up and then conducts up to 12 months program. The program is for persons who are over 18 years old, and there are two exceptions. We won't sending person to the program if he or she uses only cannabis, or if there has been driving under the influence of drugs. So what does the support person do, or what is the purpose of the support person? Basically, the role is described on the slide, but main subjects are helps to apply for documents if needed, helps to get doctor's appointments, helps to look for a job, and gives information about treatment, rehabilitation services, and helps with contacting the services. What is important to mention is that the support person is usually a former drug user. So of course we have some kind of problems as usual. Main problems are that not all of the regions are covered with the program. We would need more support persons and funding to conduct a 24/7 service, so you can make an on-scene call. And what makes difficult for the support person to help the person who used drugs, usually the person has several different diagnoses, so the treatment and help options are complicated. So about the results. Over the years, we have had over 2,300 clients. They have independently entered and referred, and some people are in the program multiple times. 93% of the people who have been in the program say that they have changed their lives in positive direction. So how I personally motivate our first responders to refer to the program is like success stories. We have had male, about 40 years old, found lying on the ground with a drug overdose. The person was referred to the CITIC program. The support person started to work with him. After getting help with personal life and treatment in rehab hospital, 2 years later, the person now is working as a consultant in one of the hospitals who treats person with a drug addictions problem. So this is all about the CITIC program, but I wanted to mention that Estonian Police and Border Guard Board uses naloxone and good Samaritan Act as well. As in 2024, In June, about 500 of our first responders were trained by the Estonian Institute for Health Development. And since then, naloxone has been used 9 times by the patrol officers. Down there is also like a positive example, what I do with to our first responders. Person X did not respond to talking or physical contact. A bystander reported that the unconscious person had used fentanyl and alcohol as well. The patrol officer administered naloxone to the person first time. Person still remained unresponsive. And the second dose was administered by the patrol officer. And then the person's heart rate started to increase. And after that, the person regained consciousness and responded to the police officer. So basically, the patrol officer saved a life. And Good Samaritan Act, we started to implement it all over Estonia in February. And basically, we have one number to call, as most of you regions. If a call is made, then basically the police won't respond to the call. Only ambulance will go, and there is no need to be afraid that a legal punishment will follow. So thank you. That's that. If you have any more questions, my email address is down there. So feel free to ask if you have any more questions. Thank you.
Thank you, and I believe we'll all have a moment of questions here as well. We'll go through all the presentations, and then we have secured some time for the questions. I myself have a few already. But so thank you for sharing the existing examples, and we mentioned a little bit about the work that has already been done, but also we want to illustrate or maybe dream or plan for the future. So I would like to give the floor to Dana and share about some future steps, maybe.
Yeah, I will try to be very fast, and I need to Boyan remind me that this all planned work around the law enforcement, judges, and bringing all of this actually. Like more or less conscious started with from the regional discussion we were hosting of this guidelines on the human rights and drug policy. We had very rich regional online call and online consultation, and there were several recommendations made on the involvement of law enforcement and this peer-led law enforcement work. We just like grab nail and the regional, global and European networks to build something around this. And by we, I mean not only Eurasian Harm Reduction Association, but the broader harm reductionists group and civil society group regionally. And I will go very fast with the yes next to support the point about the very not based on sound science criminalization in our region, and we are trying to compare the dosages, but to find it's very hard to find the proper justification, and we constantly within the network having this discussion whether it's good to have wise dosages or whether it's good to advise law enforcement judges and prosecutors to use the law and to prove the intention to sell. But the basis is that the criminalization in the region is very heavy, and like a lot of our countries, like Russian saying, it's народная статья, the most popular article in the criminal code to catch people from the street, everyday people, poor people, people from Roma community, people from migrants, working migrants, and nowadays even to catch human rights activists, independent media, because you could just put the drugs in the pocket or in the car, and that's like we all understand this environment for the human rights violations. And the next slide, I guess, will show again the how heavy and how diverse the punishment is for such a different dosages. And we have all this information in our webpage, and we are trying to update, but to find the logic in these drug laws, it's rather hard. And that's to support the message we are hearing from from our local partners, that if I'm catching the same people just because I have the indicators, that then it make my life meaningless, and my work meaningless, because if the policeman or constable or any service really serving the community, they already know each other, and that's just this cycle of the catching and recidivist and all this. So we all understand that it's have no logic in it, but we need to reduce harm, and that's our philosophy, to reduce harm of criminalization as well. And the next slide will show one more argument. And for us, when now in the financial crisis, which Europe and the globe face, I feel that this argument could work, because criminalization costs a lot. And we could calculate only the cost of incarceration, a year cost of incarceration, in comparison with full harm reduction package, opioid agonist treatment, and unemployment payment during the year. And in some countries, it could be 16, 15 times more. It costs more to incarcerate people. And we could not calculate the cost for disaggregate data on police work, judges' work, prosecutors' time. And once in the meeting we had before the war, so in Prague, with the Moldovan Ukrainian police, and they said, look, that's the very valuable and very heavy argument, because that's where we could save budgets, the police budgets. From my side, I would say yes, and spend it on the harm reduction, but not very often the law enforcement system and drug policy system want to give the money to harm reduction. But the SUTI program is one the very good example, and you could see the more detailed data using the QR code, country by country, what we could find with the support of our members and community. Next slide. That's our advocacy priorities to how to reduce the risk of criminalization. An important part here, it's about drug registry. We are addressing in several countries, specifically post-Soviet countries like Central Asia, like Moldova, even Ukraine formally already do not have drug registry, but it's still used, the list of the patients used for the police actions, because police have indicators. And these indicators of people captured for the drug articles, that's one of the key points where the police interest is against the meaningful work of police, from my view. So the next slide will go to the other work, which for us, it's also mitigating the harm of the criminalization. That's paralegal work. And I need to say that a lot of social workers, they are like support officers in SUTIC, but in the harm reduction, this is the people who will mediate between, if the person using drugs report that they have challenges in accessing health programs, or they have some problems with the documents, with the accessing support in case of gender-based violence, this social worker usually, actually, the social worker from harm reduction, it could be the only support person they could ask or report or say about their problems and human rights violations, because that's the only person who is not judging. And actually, in a lot of countries of our region, Kazakhstan, Moldova, Kyrgyzstan, Ukraine, obviously, the system of these paralegal services and social workers trained in navigating the legal documents, in documenting human rights and mediation, very good developed. And one of the important part that we are also pushing governments on the Crimea using these cases. But the next will be already on the joint position. So we have developed together with the two networks on the law enforcement and public health, and that's very big honor for us to develop the joint position. And we have 4 key directions to develop. We hope that we will find resources, and that's for us a big honor again to be in a group of like-minded organizations and trying to do the regular work on this, even in the very hard circumstances. But I'm looking at this list, and it's very much like what Gorica said, what Boyan said, what Neil said. That's about the building social trust between the civil society and social workers, social systems, and law enforcement in the broader understanding, not only police or some part of the police, but the law enforcement. And we are giving here also referring to Good Samaritan law as an important part of the building trust. The second point, which we are thinking is important, it's expanding the diversion programs. We talking here about this, developing workforce readiness and trainings on using naloxone, being part of the public health policing. And the last important objective of us is examine police performance indicators, and that's more advocacy objective from inside and from outside, because that's not about criminalization itself. It's the tool. Honestly, police indicators, it's a tool to measure the police activities and not the target setting. But unfortunately, MND always working in not a way of monitoring and evaluating, but mainly target setting and punishment. But that's important dialogue we need to conduct. And the next slide is the last one, and that's more about our partners organizing the Warsaw meeting, and we are very grateful that we are together. And QR code leading us to all materials from EMEA meeting, from Prague meeting, from all our method guidance we had, and videos from more detailed experience of different police officers who were presented there. It was one day, so much longer, and I hope that it was not the last meeting we will have on this public health policing page, but there will be more, and we will have regular. We could leave it here for people. That's okay. Nice picture and QR code.
Thank you very much. So, as we are all aware, the financial situation of harm reduction of the reformative work has never been easy, and it is even becoming more challenging these days. But as we could hear, there are activities happening, ideas developed with a joint position, with everything that has already been developed during all these meetings and will surely continue. So please do check the webpage and visit it from time to time. We do have 3 minutes for probably one question, 2 questions. Okay, or more? 2 of these. Okay.
Hi, Nick Lynn. Work with Lee, used to work for Open Society Foundations, and I'm a former police officer as well. I've worked on racial profiling and drug policy and other stuff over the years. So a very quick comment about the UK example that you shared, Neil, and Ron Hogg and Mike Barton, personalities, and where how you continue the work without the personalities, and how you sort of nail it and make it stick. So that's a question for you, and then one for you around the Samaritan law, which sounds amazing, and You may have heard the term firewall, which is it seems to me the Samaritan law is the firewall that other countries use that terminology. And I wonder what the reaction was of the police in Estonia before it was implemented, and since it's been implemented, how they feel about that new approach.
Basically, we feel we have less work to do. Not in a bad way, but there were calls that our being there wasn't appropriate or wasn't needed. And the possession of drugs were so small for in Estonia. You have to have over 10 doses to be criminalized. So basically, what I saw with the statistics slide as well, saving human life is more important than to get our drug over to get our numbers up. How much drug users we have been getting from the streets away. So basically, it's been only a month, but for us, the patrol officers, like they actually, I don't think that they even understand that anything changed, basically.
Okay.
Because we don't get the calls and we don't get the statistics as well. So.
Were they glad that this has been implemented? Do you get a sense of how they feel about it rather than, and it's early days, so maybe it's
early days,
to
yeah. And as I mentioned, we as a nation are not ready to decriminalization, but we are pro saving lives.
Sure.
So that's probably all I have to say.
They feel good about that.
Yeah.
Which is good. Thank you.
I think the question for me, so yeah, okay. What happened at the beginning of diversion in the UK was led by personalities, and those people were important because of who they were, what they could get away with, and how they navigated the press and the media. They were really good at it. But I think the answer to your question is exactly what these good people are doing, and that is the answer is always the growth of social movement. It's always how do we make this movement grow, and you can make this movement grow by connecting movements. And so if you're bringing the different groups together, you're bringing the harm reduction people in with the police, you're having those discussions like they did actually in the Polish police headquarters in December. That's a hell of an achievement, and that's how you build movement. So in the absence of clear point of contact that's pushing a movement forward, which is actually unusual to be fair. Most social justice issues, the movement grows through connections and people pushing it behind the scenes, like is happening. And I think that is the answer, and I think this is the right approach.
Thanks.
Thank you.
Thank you. Sorry, my name is Michal Kazachkin, and I'm a commissioner on the Global Commission on Drug Policy, and also on the Eastern European Central Asian Commission on Drug Policy. I have two questions. One is to Kirsty. What does it mean for the people to be in the database, and why are you having a database at all? I mean, the person you arrested or met could be someone who used occasionally or someone who uses for years, high doses, low doses. So what's the point of the database, and what does it mean for people? The second question is to Gorica and Ghana. I've been attending a number of these meetings, listening to you, and fully supportive of everything, of course. I've attended a number of the prosecutor and judges fora of UNDP. I've read a number of the publications. Isn't it time, and I think Gorica and Ghana together, and maybe with others, you should be able to do that, to actually measure progress. Could you come to a certain number of indicators? How many diversion programs in the region, where, how many, and actually not only measure whether there is progress. It's not enough to say this is what we should do. Measure progress, but also where there's no progress, try to understand why there is no progress, and then adjust and adapt to that.
Thank you for the wonderful question.
So I'm going to be first, then somebody. Yep. So because we have the database, because in Estonia it's still illegal to use drugs, and because of that, the police officer has like possibility not to punish. It's not a regulation that he or she cannot punish, because in terms of legal agreements, they have to do it. But it's like our way of bypassing, might be the word. And we do the database notice because we are referring the person multiple times to the program, usually at least 3 times, and then the officer can decide if a legal punishment follows, or they may make a new referral. So, and of course, if a person gets caught on Monday and next time you will be caught on Friday, then it doesn't count as 2 times because it has been only a week. It means that the person haven't had enough time to contact the program or get help on anything. So basically, we do the mark to the database for the next officer to know that the person has already referred to the program.
No, I understand. I was just wondering whether it had been considered to rather have an epidemiological database, let's say anonymous, but saying today I met a woman of 28 and she is an immigrant from Ukraine. And here I met a young man of 15, and never before I had met a young man of 15 using this particular substance or whatever. So to have build a sort of database of real life of what's happening on the street. But I see that the logic is still in the law enforcement and somewhere potential punishment.
Yeah, basically because they have interaction, there some kind of remark has to be made to the system.
From my side, we all understand that we are talking about this rather like for at least 5 years. 2020, I could start the starting point. And I feel more that it's still in the stage of enlargement and motivation, because the processes of the police being involved, and that's about championship. In Moldova, we had absolutely amazing the high level law enforcement team, and the last year we start working with them, but they changed. And then this like enlargement and motivation stage, for me, it's something we are doing with the community when we are speaking in a lot of initiative groups, some activists, and then we could expect that only 10% of them will be involved somehow. So that was part of my question to the networks. Maybe we need to expand the membership and to invite, because today I've heard from Czechia, we want to be the part of this membership of this professional network. So I feel that it's not the time to measure the result, because results we have, the couple of programs in Ukraine which are not unfortunately very sustainable because war is going on. They are keeping some level of sustainability on gender-based violence, on the public health referrals, but it's very tiny. And for Moldova, they want to, and we think about development. Estonia, God bless Estonia, because when learning is going on, Estonia is taking this experience, at least trying to pilot. And all others, it's like 1 step forward, 2 step back. I'm absolutely honest. So that's why I think that the next couple of years we need to be very, very productive in just enlargement, in bringing more and more and more people on board with any possible ways to engage them in this peer dialogues. And that only then we'll see any results of it.
From my side, thank you. Thank you for this and thank you for the question. It's a very, I have to echo Ghana saying that it would be both great and very valuable if we would have a lot to show in the context of measuring progress. But I'm afraid it's a bit complicated to do that because what usually follows in our line of work, to my modest experience, what usually follows sharing the knowledge and saying this is what you should do is a small pilot program that's going to be implemented in a city in the context of a country. And it is highly unlikely that this project has sufficient funding to first be sustainable and second to be evaluated. Obviously, there is always an interest and attempt to monitor the progress on the ground, to stay engaged with the stakeholders who are involved, to keep at least the training going, because as we know in many law enforcement contexts, that turnover is also high. So training, doing one training and training one police officer is not going to suffice. So I'd say it's very difficult to showcase progress, especially in this region, because there simply isn't enough to show. That being said, it's not all dark. There are obviously some contexts where law enforcement, civil society, public health institutions, and or local administrations have managed to have some sort of a mechanism of referral in place where we actually can keep track of how successful and beneficial this was. We have this situation in Moldova now, and for a couple of years, with the support of the Swedish government, actually, we have been implementing a sort of a police referral program, and we are able to see the outcome of that. We're able to see the engagement from law enforcement. We're able to see how many people are actually being referred and the positive impact that this has on their well-being and obviously on their health. We have documented at some point in the past also some attempted pilot referral programs in Ukraine, in Kazakhstan, but as I said, these are not a massive, very sustainable projects.
I realize that, of course, but I'm sort of going back to what Ghana, I think you said, is changing the legislation in the region is a huge challenge, and it will take lots of time, even if we had the Tajikistan example after 15 years of effort. But then I actually think that the small things that are happening are meaningful.
Absolutely.
And if no small thing happens, then it's really bad. But if several small initiatives with police start, particularly in a given country, it helps you see a trend. And you can see trends of countries where things start happening and countries where nothing starts happening. And then you can ask yourself the question, why? Is it because I have been distributing leaflets in the latest publication from UNDP, but no one has read it? Or is it because the head of police, we didn't have a good enough interaction? Or what are the structural reasons? So I think it's still useful, not to just say, well, we don't have significant enough result to showcase. It's not about showcase. It's about following up, beyond producing these documents and declarations.
That's absolutely right, and that goes without saying. But I think this is why we're here. This is why we have continued the momentum that was in Prague. This is why we have done the Sweden conference, the Warsaw. And as Ghana said, I'm really hoping that we can continue that. And another thing that I think was also a very valuable outcome of this conversation and of the conversation in Warsaw and feed into the points that you have raised, that we need to document these things and we need to be able to kind of show them to the law enforcement officers, but also to all other partners that this actually works. Because as you said, even the small examples, which we do have, that are not massive projects, but that are still successful and operational to an extent, police listens to police. So if they can see that something works, they will definitely take it in consideration, if nothing else, or pay attention, which is what we want at this early stage. So yeah.
And the next time we will do QR code for police event, join the network and they will educate you. So I think that we need to really expand, because that's not our business to bring them to our network. It's more like to bring to your network and to help to share more examples.
I like that, but part of it is also educating the non-police partners how to tactically engage with police as well.
Absolutely.
So it seems we've got the next steps identified, and I believe that the words of hope and encouragement from the Global Commission are a very good closing point. So I believe we're all living with a lot of questions. I myself I'll bring them the next time. And as I usually say, we're not stopping here. It's just a pause until the next time, next conversation, next meeting. So huge thank yous to the speakers, to all partners, and to the audience as well. Thank you.